is one of my favorite questions, because how often do I get to give people a thumbs up that they can continue one of their vices, which also happens to be one of my vices. Study after study has been done over the last 20 to 30 years to address this exact question. Is caffeine good for you, or am I doing myself any damage? And it appears that for the average person, caffeine has more potential benefit than harm, which is great news. Specifically, we've seen a reduction in the pattern of several illnesses and diseases in people that consume a moderate amount of caffeine per day, which would basically boil down to 2 to 3 cups of coffee per day. I guess it sort of depends on the size of the cup, but in any event, the diseases specifically that we've seen a reduction in include type 2 diabetes, certain neurological disorders like Alzheimer's and Parkinson's disease, and some great news that we believe certain cancers actually are reduced or seen less frequently in people that consume coffee on a regular basis. Specifically, women's risk of endometrial cancer, which is the cancer of the lining of the uterus, drops in incidence in people that consume coffee. For men that consume a large quantity of coffee, the risk of prostate cancer goes down. And for all comers, the risk of liver cancer seems to be lower in people that consume coffee on a regular basis. Additionally, one of the more recent studies showed an 11% reduction in cases of congestive heart failure in patients that, or in people that consume coffee. So that's all great news. Another great benefit is we see an antidepressant effect with coffee. So if you overshoot though, you might find anxiety and tremulousness and insomnia. So it's really a matter of trying to find the right balance. And there are certain people for whom caffeine is not as good an idea. Specifically, as we mentioned, insomniacs, people that are anxiety prone, or people that have problems with rapid heart rates, because it's a stimulant, bottom line. We know that in people that drink caffeinated beverages, the benefits might arise not so much from the caffeine, but from some of the perhaps antioxidant qualities, or in some types of caffeine, the fiber component, or some types of caffeinated products, the fiber component is significant. So the good news, I'm not going to tell you to give up your Joe, just try and limit the amount that you have and use it responsibly.